Okay, now what I want to focus on is how does a CRMA test actually help you to determine future care for the patient? Like, is future care important? Of course it's important. There's things called, supportive care. Supportive care is those things that the patient needs in order to maintain their condition. Insulin is a supportive care treatment. It's not curative. It's supportive. It's not going to cure diabetes, but it's going to support the patient who has diabetes in order to be able to live a normal life. Now, no different with spinal injuries right now. Right now, spinal injuries in the market are the number one, first, fourth, and sixth leading cause of chronic pain and disability. Okay, they're the most expensive injuries in the market today, bar none. The American Pain Society says that if a person has chronic low back pain as a result of a lumbar injury, they're going to spend anywhere from $9,000 to $19,000 per year annually just medically managing that condition. The U.S. Pain Foundation says people that have chronic pain are going to spend $7,700 more in medical services per year managing that condition. The American Headache Society says that anyone that has headaches, specifically migraine headaches, is going to spend around $8,900 more in medical services per year. That's the first, fourth, and sixth leading cause of chronic pain and disability. And that's a problem. Now, the doctors in the market that can reduce that, the doctors in the market that are really good with the injuries, and the primary thing you have to get good at with injuries is you have to understand what you're looking for in the first place, which is problematic in the market today because nobody's been educated formally in any of their educational institutions on spinal injuries. The medical doctors have not, the chiropractors have not, the physical therapists have not, the osteopaths have not. The naturopaths have not, the acupuncturists have not. There is no formalized educational curriculum in any healthcare provider school in the country on spinal injuries, yet they're the first, fourth, and sixth leading cause of chronic pain and disability. So it's no wonder the statistics are so bad right now. Now, what you have to understand is it's not the injury. The injuries are the same. Standardized spinal injury workups should be the same. Patient comes in, they actually have an exam, they go through a consult, they have an exam, they take x-rays. On the x-rays, they should grade the sprain, rule out surgical, rule out activity restrictions, know where the impairment level is immediately. They should basically also know exactly where the facet injury is. They should know from the excessive motion test how much excessive motion or how much damage there is to the facet, and they should be able to work up the main profile of a myopathic brain injury, which is the cervical profile. So with all that being said, that's not really being done today, so you have these high chronicity rates and you have a lot more supportive care necessary in the market today that I think in the future will reduce significantly. As treatment innovators understand what the condition is, they'll treatment innovate. But for today's process, okay, what does that actually mean? Well, it means that you basically, most providers will do what's called a trial of treatment withdrawal. So whatever you're using, whatever condition you're using, first of all, in order to have any supportive care need, you have to have an injury, and the most significant injury. So when I say, hey, CRMA helps with determining future care needs, it helps to determine the severity and location of the non-disc ligament injury or the amount of spinal instability that's associated with that condition. Because excessive motion is the main imaging biomarker for the non-disc spinal support ligament injury, and it's the main imaging biomarker that has to be correlated in a spinal instability workup. So that's what it tells you. It tells you how bad the injury is. Now, the injury is the same. The people that have the injuries are all different. They have, many will have dormant pre-existing conditions that severely make this spine more predisposed to more damage. They may have other comorbidity. They may be overweight. They may be obese. They may have high blood pressure. They may have adult onset asthma. They may have a myriad of other conditions. And so that all has to be taken into consideration. But the main way that CRMA assists with future care is the fact that it tells you immediately how bad and where the injury is. And then the results of your procedures, the results of your care need to go to MMI. And at MMI, if the patient under a trial of treatment withdrawal cannot sustain progress, then you have grounds for supportive care. But the grounds for supportive care are always based on the grounds of the injury, and that's what CRMA provides.